Antimicrobial resistance is one of the top public health issues globally. Thus, every year, a week is set out in the month of November to create awareness about antimicrobial resistance. And so today, we're going to tell you a few things about antimicrobial resistance. Come along with us.
First, we have to define some terms, and these are microbes, antimicrobials, and antimicrobial resistance. Microbes are tiny microorganisms that can be seen with the use of microscope, and these include viruses, bacteria, fungi, and parasites. Antimicrobials, they are drugs that are used to inhibit the growth of microorganisms. They can be produced naturally or with the use of chemicals. Antimicrobial resistance is a serious, complex issue that arises when microorganisms no longer respond to the use of drugs. Drugs that are used before are no longer effective in killing these microorganisms.
While antibiotics are not the only antimicrobial agents, the focus on antibiotics resistance is due to the fact that antibiotics are among the widely used antimicrobial agents and their use is pervasive in medical practice. Now let's talk about how antibiotics work. The mechanism of action of antibiotics can be divided into three steps. Number one, antibiotics penetrate the bacteria either by active diffusion or passive diffusion. Number two, they bind to specific sites in the bacteria. Number three, they disrupt special processes that keep the bacterial lead out, like the synthesis of proteins and the synthesis of the cell wall of the bacteria. All these processes culminate to the destruction or the halt of the multiplication of the bacteria.
What about how antimicrobial resistance develops? Generally, antimicrobial resistance is an evolutionary process that bacteria undergoes to avoid destruction. This is how they do it. They prevent the entrance of antimicrobials into them. They change the shape of their target sites so that the antimicrobials cannot bind. They destroy the antimicrobials through enzymes before the antibiotics are even able to disrupt any processes within them. And they remove the antimicrobials such as antibiotics through pumps in their cell wall. Did you know that bacteria that develop this resistance can pass it on to other generations and to even bacteria that was not originally resistant?
I'm sure we've learned some things so far. So now let's bring this home by talking about things that we do that fuel antimicrobial resistance in microbes. The first point I'll be talking about is the inappropriate use of antimicrobial agents like antibiotics in humans and animals. Inappropriate use of antibiotics can either be misuse or overuse of antibiotics. For example, frequently using antibiotics, self-prescription of antibiotics, using a high dosage of antibiotics than required, and prolonged use of antibiotics. The second point would be use of poor quality water, lack of sanitation, and poor hygiene. Also, we're talking about the inadequate infection control practices and also poor food handling.
Having talked about some of the actions that are fueling antimicrobial resistance, I want to move ahead to highlight some dangers of antimicrobial resistance to us and also to the environment. First, I want to start with talking about the drugs becoming ineffective. What this means is that some of the antimicrobials we've known prior to this time, like antibiotics, will become ineffective in killing microbes. Consequently, it becomes harder to treat infections. This is because infections that were once adequately and promptly treated because of the antimicrobial resistance will no longer be able to. And this would mean that some infections will take a longer time to be treated. Worse still, there may be no treatment. The other danger is the fact that we may have to resort to alternative drugs. Due to antimicrobial resistance to some antibiotics, we may have to use alternative drugs to treat, and this may be costly and not economic friendly. Lastly, the risk of surgery, transplantation, and even chemotherapies will become more high because of antimicrobial resistance.
So here are some misconceptions about antibiotic usage. 1. Using antibiotics for viral infections like cold, catarrh, and cough. 2. Stopping the usage of antibiotics just because we feel better. 3. Sharing of antibiotics with friends and family.
Another misconception we have is using leftover antibiotics. Normally, when a doctor gives you antibiotics, you are required to use it for a number of days. So perhaps you miss some medication at noon or at night, and the antibiotics is still remaining. You are expected not to use it for another infection or keep it for future use. You have to discard it right at that moment. Expecting a doctor to give you antibiotics for every infection is a misconception common among you Nigerians. When a doctor don't give you antibiotics, you are not expected to assume that the doctor made a mistake or he forgot, and then you go to the pharmacy and get antibiotics. Using antibiotics because you feel you haven't used it for a long time and you feel infection is setting is also a great misconception. Antibiotics is not a joke to be used frequently or anytime. In case you are sick, make sure you get to the hospital or you visit a doctor and get treated appropriately. Do not self-medicate.
Alright, let's conclude with how we can prevent antimicrobial resistance. It is a complex issue and its prevention will require a multi-sectoral approach. The WHO Global Action Plan gives us a framework on how we can tackle antimicrobial resistance, and I'll be outlining them. The first point is to improve awareness. It's our responsibility to inform our friends, families, and those around us on what antimicrobial resistance is and how we can go about it. Second point is to reduce the incidence of infection. Our food handling, our sanitation, and our cleanliness must become optimal. The third point is to optimize the use of antimicrobial agents. That is, the use of antibiotics must be as prescribed by a physician. The fourth point is to strengthen our evidence and knowledge base through surveillance and research. The fifth point, which is also as important as the previous four, is to increase sustainable development into development of new medicines, which will help cure diseases.
It's been a nice ride so far. We have been able to define some important terms as it relates to this topic. We've also been able to give a brief overview of how antibiotics work and how antimicrobial resistance develops. We also talked about the actions that are engaging and fueling antimicrobial resistance and the dangers that loom if antimicrobial resistance is not curbed. We ended with common misconceptions about antimicrobial usage and its prevention. Now let me ask you a question. What are you going to do as a fellow guardian of antibiotics? How would you slow down the rate of antibiotics in your own way? Let's do this together.